So
Yeah,
myself, I'm a big fan of like functional medicine or like going to the root causes of all the problems, lifestyle change and everything. But at the same time, there are some medical conditions that needs to be targeted by medication. And if
yeah,
they like stop it themselves, it can be very dangerous for them. And all the cardiac problems, it can be like it can take your life. So it's just
sure,
better not to risk it. And it's good
definitely.
to like educate like people that it's not the case, and if you're feeling good or if the number is normal, it doesn't mean that you need to stop. How often do you recommend for general public, for a healthy person, that they're not feeling any symptoms and they don't have any other medical condition, to check their blood pressure?
Sure. See, the blood pressure should be checked even in younger individuals. And when I say younger individuals, I'm not talking about young kids, but as they get to say even in their 20s,
Adults.
yeah, then yeah, 30s, 40s, yeah, correct. Adults, I would say, yes. But children also, they have got high blood pressure, but it is rare. So mainly it is the adults above the age of 18. We should routinely check blood pressure. It becomes even more common as an individual gets above the age of 40. Because as you age, the incidence and prevalence of blood pressure does increase.
Regarding to hypertension, like what symptoms I should feel myself as someone that no, I don't have any information, that I know that I need to go either to the emergency room or go to a doctor.
Yeah, I think that's again a very, very important question. Say, majority of the patients, they will not have any symptom. And that's why I said in the beginning that it is called a silent disease and can lead to catastrophic events and including death. And that's why it is also called a silent killer. But if the blood pressure is very high, then yes, it can give you certain symptoms. One of them may be headache, which is very common, some dizziness, some chest heaviness, difficulty in breathing, palpitation. So these are the symptoms you may experience. Sometimes there may not be any symptoms, majority. So that's why it is important and vital to get someone's blood pressure checked from time to time. One thing is, you'll be surprised by certain numbers which I've told you what the prevalence is. But unfortunately, science has progressed, and hypertension is a very common disease, not a rare disease. We see very commonly in your clinical practice.
And
But what is sad about it, that still only 21% of the patients they have their blood pressure controlled. That means almost 80% of the patients do not have their blood pressure controlled, which is very sad. Despite all the research that is being done, we have got wonderful medications in the market that control the blood pressure, but large uh, proportion of the patients, they do not have their blood pressure controlled.